Traditionally, Black people have not accessed mental health care for various reasons, and one of that was just not feeling that their concerns or problems could be easily relatable. It wasn't relatable to a lot of the clinicians that were providing these services. So we felt training clinicians and building their capacity was sort of the first step in at least encouraging Blacks to access mental health services. Mental health impacts every area of life. We look at criminalization, we look at family structure, we look at physical health. There's a lot of concern within the Black community that there's not enough access to mental health care. We know since COVID, which is the plus side, because there's been such a need and the concerns and the issues have been so dire, Blacks have reached out, and they have been reaching out specifically for Black identified therapists or those that identify with their issues. So we want to continue that. We want to continue that momentum and make sure that they continually feel like they're supported through programming, through services, through training of these clinicians. So what our project is doing generally is that we are promoting workshops, and then we're providing them either virtually or in-house. We're reaching out to every potential organization that we feel can benefit from these services, and that includes frontline workers, that includes clinicians, that includes clergymen, just anybody who we consider to be a health professional who's already working in that capacity, where mental health is an issue, and where we feel that they could just be benefit from having this type of training. The training is very much focused on two areas. One is on Afrocentricity, and Afrocentricity just speaks to taking into account the history of Blacks in Canada, the trauma, systems, sort of the anti-Black lens, and actually incorporating that into therapy. Why that matters. Why does it matter where Blacks come from, where they come from, what they've experienced being Black individuals, what type of situations or instances or experiences are unique to them as Black men or Black women, and why that's important to incorporate that into therapy. What can we take from the African culture that might be useful, even if it's generations later? And the second piece is racial trauma. Simply as a result of being Black, there's some unique instances and experiences we go through just as being Black individuals.
A lot of people don't really understand why we specifically target Black people and not just race or people of color. I feel like, when you generalize people of color into like a big general group, you kind of take away the specific things that are tied to those cultures and to those, upbringings that you might have, or certain experiences you may have because of specific trauma and prejudice. And I feel like when we target them individually, our whole scope, our whole message of Black Men's Health Canada is to promote a sounder mind. And I feel like promoting a sounder individual promotes a sounder mind for society.
It's been extremely enlightening and rewarding to see clinicians feel like, wow, we've got some tools here that are relevant to the work that I'm doing with this particular individual, these particular issues, with this particular lived experience.